How are CFTR gene results interpreted in cystic fibrosis? Understanding how CFTR gene results are interpreted is crucial for diagnosing cystic fibrosis. The CFTR gene is responsible for producing a protein that helps regulate salt and water in cells. When interpreting test results, healthcare providers analyze the presence, type, and combination of mutations in the two copies of the CFTR gene, one inherited from each parent. Cystic fibrosis occurs when both copies of the gene carry disease-causing mutations. If only one copy has a mutation, the individual is considered a carrier. Carriers usually do not show symptoms but can pass the mutation to their children. The first step in interpretation is identifying whether mutations exist in the CFTR gene. Over 2,000 mutations have been identified, but testing often focuses on the most common ones. For instance, the delta F508 mutation is prevalent in many populations and accounts for a significant portion of cystic fibrosis cases. Genetic testing can involve targeted mutation panels or comprehensive sequencing methods. A positive result showing two disease-causing mutations confirms a genetic diagnosis of cystic fibrosis. However, this must be correlated with clinical findings and additional tests, such as sweat chloride measurement or nasal potential difference, to confirm the diagnosis. If only one mutation is detected, it indicates carrier status or the possibility of CFTR-related disorders. These disorders may present with milder symptoms or atypical features. It is important to note that the effects of CFTR mutations can vary widely. Therefore, genotype alone does not always predict the severity of the disease or specific symptoms. Some mutations may lead to pancreatic insufficiency, while others may result in milder forms of the disease. In prenatal or newborn screening, if one parent is a carrier, the other parent is tested to assess the risk for their child. If both parents carry CFTR mutations, there is a 25% chance that their child will have cystic fibrosis. Newborn screening typically involves measuring immunoreactive trypsinogen followed by CFTR mutation analysis and confirmatory sweat testing. Overall, interpreting CFTR gene test results involves determining mutation status in both gene copies, classifying mutations as disease-causing or benign, and correlating genetic findings with clinical symptoms and diagnostic tests. It also includes assessing carrier status and reproductive risk in families. Recognizing that genotype does not fully predict disease severity or prognosis is essential. This integrated approach helps ensure accurate diagnosis, informs prognosis, guides treatment decisions, and supports genetic counseling for individuals and families affected by cystic fibrosis. Always consult healthcare professionals for personalized medical advice.